Okay, I think we'll just start now, but I think we'll just do a little bit of intros first, so it gives people a few more minutes just to log on and manage to get on the Zoom call. We appreciate that there's been a bit of a last minute change with the hosting platform, so thank you very much everyone for your patience. I know it's been a bit of a last minute switch. But hopefully we've got everyone now. So just wanted to say, yeah, thank you very much for coming on to this webinar. So my name is Rupert. I'm from Protexin Veterinary. And as you may know, we're doing a webinar today to talk about behaviour, specifically the behavioural first aid for the veterinary teams. So what you can do as a first line vet in terms of cases that you might see and advice that you can give on behavioural things, and just some pointers really in first opinion practice. So we're running this webinar. We're very pleased that Rosie's managed to join us for this, because she's got some fascinating insights that I can't wait to hear. But we are running this because we have launched obviously our new product Serenacare, which is a calming product for dogs and cats. So this is in conjunction with the launch. We're not really going to talk about Serenacare. This is more of a behavioural session today, but I just wanted to have a quick mention before I then introduce Rosie to you all. So first and foremost, we can see I'll put this offer up at the end, but for all of you that use Maxipro and Tips, so all of you from Hong Kong and Singapore, we do have this this offer on Serenacare at the moment. So after this call, if you'd like to make a note of these numbers and contact Maxipro for some further info and offers on Serenacare. And also, if you're from South Korea, then our distributor, Samdong, will be in contact with you after this webinar to give you your free Serenacare. So some great stuff going on with our distribution partners. So we're really grateful to them for the support. So I just wanted to have a very quick word before we get into the really good behavioural stuff from Rosie. So just talk briefly about our new product, Serenacare. So many of you will have seen this. So as we said, a calming support for dogs and cats, which contains a novel postbiotic blend, alpha-casozepine, which is the same ingredient as Zilkine, and L-tryptophan as well, and also a prebiotic called Fibersol. And this is a daily sachet, which is used to help manage stress and anxiety. So we might be using it for any cases that we, I mean, we might discuss a little bit later about behavioural things, but any sort of calming or anxiety cases that we need. And the reason this is working so well is because of these key ingredients. Now, we won't go into them too much at the moment. I'm sure our partners in Hong Kong, Singapore, and South Korea will help explain a lot of these to you. But as you can see, we have alpha-casozepine, tryptophan, our unique postbiotic blend, and also a prebiotic as well. So the focus of this product is having direct calming ingredients, but also working on ingredients that are going to be helping the gut and the microbiome, and really supporting that gut-brain axis, which we know is such a huge talking point at the moment. And the key thing is that it is artificial chicken flavored as well. So as we said, any cases for stress and anxiety, so things like noise sensitivities, any stressful situations like vet visits or moving home, general anxiety, separation anxiety, and also social fear. The way we're going to use it is begin supplementation 2 weeks prior to the expected anxious event, and we're going to give it once a day according to weight. But we do know that you can use it just before an expected anxiety-inducing event. So, for example, if the owner is taking the cat to you at the clinic, then you can say, maybe let's give an additional dose 90 to 120 minutes beforehand. So lots of different indications. And we can use it long-term, short-term, medium-term, as long as we're using for at least 2 weeks. As we'll find out today from Rosie, I mean, the whole point of this really is that ideally we don't want things on this long-term. We want to try and do behavioural training, behavioural support instead of that, or in conjunction, but the option is there if needed. And you can increase or decrease the dose if necessary. So this is our new product that we wanted to mention. But as I said, the main focus today is on behaviour. So just see how we're doing for attendees. Yep, we're okay. So I just want to quickly introduce Rosie, if that's okay. Right, yeah, but me, it can probably see, hopefully everyone can see on screen. Let me just Okay. So as I said, we have Rosie with us today. So Rosie is a fully qualified clinical animal behaviourist with a degree in zoology and psychology from the University of Bristol. Very lovely university, very good, very good city. I've been there many times, and is a postgraduate, has the postgraduate diploma in companion animal behavioural counselling from Southampton University. She's also an ASAB certificated clinical animal behaviourist, a full member of the Association of Pet Behaviour Counsellors, a member of the Professional Association of Canine Trainers, and registered as both a clinical animal behaviourist and as an animal training instructor with the Animal Behaviour Training Council. So loads of different qualifications there, as you can see, but we're really pleased to work with her today, really, because she's just fantastic at talking all around the things we can do in terms of behaviourally. Certainly when I was in practice as a vet and when we're at university, there's not that much support in terms of what we can do in terms of supporting behavioural cases and different things we can sort of instigate and things we can talk about with owners. And this is where Rosie comes in, absolutely fantastic at sort of explaining all the different nuances, things that us as vets wouldn't necessarily talk about or think about. So I think that's everything from me. So I'll be quiet now, and Rosie, over to you, if that's okay.
Thanks, Rupert, and thank you to Protexin for inviting me to speak to you all this evening, and thank you to everyone that's given up some of their evening to learn a little bit about behavioural first aid that you can give to your clients when they come in with their dogs and cats, and you know, just as they're about to leave, mention that they're having quite a difficult behavioural challenging time with their pet, and expect you to be able to wave a magic wand and give advice that can resolve it as quickly as they hope. So let's just start off by talking a little bit about emotional welfare. So it's really important, first of all, to understand that mammals, I should say, experience emotions too, the same as humans do. And that as vets and vet nurses and veterinary staff, we're generally trained to help resolve physical issues or prevent physical issues from occurring. But we do need to appreciate that emotional welfare is as important as physical welfare when it comes to these animals. And I think that's particularly important to consider if we are giving preventative physical treatment, that we're not compromising the animal's emotional welfare when we're attempting to give preventative physical treatment. And it's always a bit of a balance in weighing up the pros and cons of getting something done to resolve a physical issue or prevent a physical issue, but at the expense of potentially causing trauma, emotional trauma, to the animal. And the main three negative emotions that we talk about for dogs and cats would be anxiety, fear, and frustration. Now, anxiety and fear normally get lumped in the same category. We kind of talk about them as one. There is a slight difference, so we're going to just talk about the difference between them in a minute. And then we're also going to talk about the role of frustration. And I'm going to go through some case studies towards the end of this presentation that hopefully highlight that unfortunately it's rarely straightforward that an animal is experiencing just one of these emotions. And it's normally a kind of conflict of emotions that's caused, which makes our lives a little bit more challenging. So anxiety, the definition of anxiety would be when we anticipate that something negative might happen, but we don't necessarily know when it might happen, or we don't know where it might come from. Fear is when we are exposed to either a perceived or a real threat. And generally, most animals will have two strategies when they are presented with what they perceive to be a threat. They will either try and get away from it, so create distance from it, or they will try and drive something away. So they'll try and create distance by scaring away the scary thing. They do have some other strategies as well, which we'll come on to in a little bit more detail in a minute. And then frustration is when an animal is motivated to gain access to something or to avoid something, but they're unable to do that. And again, think about all of these emotions. Let's just think about them in the veterinary context. So we might have a dog or a cat that as soon as they enter the waiting area or the reception area of your practice, they might start to feel anxious. So they might start to think, I know what happens here. I've been here before, something not that pleasant happened to me, or I was in pain when I last came here, and therefore I'm already starting to feel a bit anxious. It will also be to do with the smells of the practice, the chemicals, the cleaning products, the smell of other stressed animals perhaps. So lots of triggers that will start to induce anxiety. So they're anticipating something unpleasant might happen, but they don't know when it might happen. Then when you might bring the animal into the consulting room, you might start to examine them. The animal at some point may start to feel the fear response. So this is the point at which they feel that you are threatening or you're about to do something that is going to be threatening, something that's likely to cause pain. And the animal may want to try and get away from you or try and scare you away from them. And at the same time, our handling, our restraint, putting the animal on the table, closing the consult room door, having the dog on a lead, are all thwarting that animal from being able to avoid the thing that they're trying to avoid. So we're likely to induce some frustration there as well. So just looking at it in the context of the veterinary environment, we can see how all three of those negative emotions might be at play in a lot of those animals that come in to see you. We also know that there's a huge link between all physical and emotional disorders. So we know that there's an overlap between musculoskeletal pain, gastrointestinal issues, dermatological issues, cognitive dysfunction, sensory deprivation. So when animals start to lose their sight or their hearing, that is going to have an impact on them behaviourally. And so in particular, as Rupert's already started this off with the gut-brain link, we know that there is lots of studies now that show that this is a two-way interaction. So we know that when we start to feel a bit stressed or anxious, that can have an impact on our tummy. And that can happen both as a chronic issue and in acute issues. In dogs that experience acute trauma or an acute fear response can lose control of their bowels. And vice versa, we also know that when we have an upset tummy, that then has an impact on our brain. And this is where Serenacare really comes in, because it works both directions, because it's got both the prebiotics and the postbiotics in there to help with the tummy, but it also has the L-tryptophan and the milk protein to help with the brain. So it's quite a unique product in that it's dealing with both of these things. And interestingly, I am increasingly seeing behaviour cases that also have issues with their tummies, and whether that's due to food allergies or intolerances or gut parasites, or it's just a stress link going on, back feeding to the gut. But I'm increasingly seeing a bigger link there. We know from studies that anything between 28 and 82% of behaviour referral cases had underlying pain. And we also know that there is a big link between, in particular, noise sensitivity and musculoskeletal pain. And there are two reasons for that. One is that any pain, illness, or discomfort will sensitize an individual. And that means that they are already feeling their body is physically already stressed, and so they are less able to cope when there are triggers that induce further stress. It might be behavioural triggers that induce further stress. They are less able to cope with those triggers. And the other, when it comes to noise sensitivity, is that if a loud noise goes off that creates a startle response in the animal, and that animal has some underlying pain going on, the startle from the noise can trigger a pain response in the animal, and they then start to associate or link loud noises with a pain response, and that can induce the fear response of noises. We also know from lots of studies that there is a link between dogs with noise sensitivity and separation issues. So again, we can deduce from that that animals that are experiencing musculoskeletal pain are also more likely or less able to cope when they are left home alone. And again, I think that's normal in animals that have an attachment to humans, because when we are, same as children, when children are feeling unwell, they become clingier to their attachment figures. They want the comfort of their attachment figures nearby. In some cats and dogs, clinical exams might be limited. They might be very, very anxious at the vet practice. They might be using aggression to try and keep you away from them. They might be just desperately trying to get away so that you can't examine them properly. They're also, these cats and dogs that are feeling anxious are also going to be carrying a lot of bodily tension, which makes manipulation and getting a response from them, a pain response from them, quite challenging. They're going to be pumped with adrenaline, which also will mask signs of musculoskeletal pain in particular. So all of that can be challenging. So how do we rule out particularly pain issues in these animals if they are presenting with behaviour problems? So we always say that it's better for vets to treat suspected pain first rather than to consider its significance when the animal doesn't respond to behaviour therapy. So if in doubt, always consider a pain relief trial for 6 to 12 weeks, and that can be alongside behavioural therapy, but it's best not to delay that if you're not sure from videos or watching an animal moving around outside the clinic, perhaps. If you can't examine it up close and you're still not sure, then a pain relief trial. And or depending on the problem, if it's a cat that's toileting in the house, for example, then you might want to run a urinalysis and or some relevant bloods. So let's talk about anxiety in particular. We all see anxious pets in the clinic, but let's just point out some very clear body language signs that they show when they are starting to feel that anticipation that something unpleasant might happen. So dogs, when they are feeling anxious, can show a variety of body language signs, but normally they will be in combination with each other. So they're very rarely just solitary body language signs. So dogs, when they're stressed, will start to pant, and this is slightly different to when they are feeling physically hot or have done a lot of exercise. So the stress pant, the backs of the lips will be pulled all the way back, and you'll often see the back teeth, the back molars. The tongue will often be quite far out, and again, it will be in combination with other body language signs. So you've got a dog here in the pictures that's showing a stress pant, but he's also showing his ears are pulled back, his eyes are very wide. Some dogs will raise a front paw when they're feeling anxious, like the dog in the middle here. You can see her body language is pulled all the way back as well. So she's desperately trying to gain a little bit of space from whatever it is, the photographer towering over her. You can see, again, her ears are pulled back. And you can see, even though she's not panting, the corners of her mouth are also pulled right back. Now, the paw raise, we think, is an animal that's either saying, I'm vulnerable, please be nice to me, or that they're getting ready to move away as soon as they feel they can. So as well as dilated pupils and wide eyes, we can sometimes also see the whites of the eyes in a dog. We call it whale eye in England. And that is where the dog is showing a lot of facial tension, and it's causing the eyes to bulge. And it might also be that they're trying to keep their eye on a potential threat. The tail is very communicative in our dogs. We know that a tail that is tightly clamped down or underneath the dog is doing so to try and prevent giving away information from their anal glands to a potential threat. So they're trying to desperately make themselves feel safe and not so vulnerable, giving information away about their emotional state. Some dogs will salivate excessively or drool excessively. If we go back to the tail a minute, the other thing that's quite important to point out is that some dogs will still wag their tail when they are feeling stressed or anxious. And they might do that with their tail up or their tail clamped down, but a wagging tail does not always equal a happy dog. They will wag their tail through positive arousal, but also when they're in negative arousal state. And obviously you might get some vocalization as well with these dogs, whining, barking. You might get some lip licking or tongue flicking, and you might get a dog that does a lot of yawning. Again, this is generally excessive, so don't panic if a dog yawns once in your clinic. But if they're repeatedly doing it and they're turning their head away, as in the first photo, and their ears are back and they're just desperately trying to avoid interaction, then that is all signs that a dog is feeling anxious. And when it comes to cats, they will, again, their eyes will dilate, they'll have wide eyes, they will generally try and make themselves smaller and crouched, their tail might tuck right round them, they will attempt to find somewhere to hide to avoid the situation or to jump up high. And also a much more subtle sign in cats is when their whiskers point forward and you can see all the protrusion of the I forgot the follicles, whisker follicles on their cheeks. So what do we mean by first aid advice, behavioural first aid advice here? I'm not here to talk to you about veterinary first aid advice, but behavioural first aid advice. So what advice can we give clients that come into the clinic and they mention that they're having behaviour problems? So by first aid advice, what I mean is advice that prevents the problem from getting any worse or from anyone or an animal from getting hurt. And the way that we would advise doing that is by avoiding the triggers, basically. So can you help in a 10-minute consult, can you help the owner identify what the triggers are that causes the animal to react or to display the unwanted behaviour? And a lot of the time that's really obvious. It's when the owners leave the house and the dog is left home alone, or it's when they're walking along the road and the dog sees another dog and it barks and goes berserk. But sometimes identifying the triggers can be a little bit harder, and it might take a little bit of questioning to work out what those triggers are. And obviously, avoiding those situations isn't going to solve the problem. However, if the owner repeatedly puts the animal into the same situation where it does display the behaviour problem, that animal is simply rehearsing that behaviour problem, and rehearsal will make the behaviour stronger. If you think about it from a neurological perspective, every time that animal is in a situation where it rehearses the behaviour, that link in the brain becomes stronger. The neurons fire in that direction, and next time the animal's in a similar situation, it's going to resort to that behaviour potentially quicker, with less provocation. It's going to be even less tolerant. Something must be reinforcing that behaviour for it to be maintaining. So the first step for both veterinary first aid and from a behaviourist is to say, for now, we need to avoid those situations. And that's both from a behavioural point of view for the animal, but also because it might be that it's a safety risk and we need to make sure nobody gets hurt. So we also might need to be advising things like muzzle training for dogs. And that is where we would train the dog to happily put their nose into a basket style muzzle, rather than us strapping a muzzle onto their face and them getting very stressed by it and pawing at it and trying to pull it off their face. We might need to implement baby gates at home, or pens, or any sort of segregation, the form of crates, for example. We might need to implement house lines in the home so that a dog walks around with a lightweight line trailing from a harness or a collar, so that if there's a situation that an owner needs to move that dog from, and grabbing it by the collar perhaps is a trigger for it to bite, they might need to have a line trailing, and we can pick up the end of the line and guide the dog away from a situation. On walks, we might need to advise owners keep their dog on a lead, or a long lead at the very least, rather than letting them off the lead if there's risks to the dog or to public by letting the dog off the lead. So we just need to have a think about the kind of management tools that we might need to advise owners and get them started on some muzzle training in the practice, for example. And we also want to make sure that the owners are not using or stop using any punishment. And obviously this is quite a natural human response when we find something stressful, when it's embarrassing to us as owners, or when we don't know what else to do, and we believe that telling the animal off might stop them from displaying that behaviour again. Unfortunately, what's likely to happen is we're going to increase that animal's stress levels in general. We're going to increase their anxiety because they're going to anticipate something negative might happen from their owners, their attachment figures at some point. And we're going to increase frustration. So where we're suppressing them from being able to display a behaviour that they are very motivated to display. And we might need to think about supplements in the form of Serenacare or medication, for example, to help dogs or cats kind of with an immediate situation to prevent them feeling so fearful or stressed in particular situations. So we use the term trigger stacking to communicate with an owner what happens when an animal starts to feel stressed or is exposed to various triggers. And I like to use an analogy of a sink or a basin. And each of us, each animal has got two taps. We've got a hot tap and we've got a cold tap, and we've all got a plug, which is how we drain our sink. And all of us have got different volumes of sinks in the first place. So some of us, through genetics or early life experiences, might have very small, shallow sinks, whereas others might have great big bathtub-sized sinks. And those of us with great big sinks can cope with a lot more stress in life than those of us with a very shallow sink that can't cope with very much. And unless we've got chronic stress or chronic pain or illness, which a lot of our animals will have, but just for example, let's just say we all wake up in the morning with an empty sink, and then throughout the days or the weeks, our taps turn on and our sink fills up a little bit at a time until our sink is full and going into the overflow. And when the overflow happens is when the animal is really exhibiting the unwanted behaviours. So arousal is cumulative over hours, days, or sometimes even weeks. And arousal can be positive or it can be negative. So the hot tap is our negative arousal, which means that there is also a risk of getting burnt. If the sink overflows with very hot water, there's not only a risk of a flood, but there's also a risk of getting burnt. Whereas the cold tap is our positive arousal. So it keeps the temperature of the sink lower, but there is still a risk of a flood if the tap is turned on a lot of the time. So human examples of positive arousal might be adrenaline junkie sports like skydiving or going on a roller coaster or going to a rock concert. So things we enjoy, but it makes our adrenaline right up here. And it's not something most of us could cope with doing all day, every day. And your negative arousal would be your emotional responses, your fear, your anxiety, your frustration, and your pain and illness. And both of the taps cause adrenaline, that just prepares us for action. But the hot tap also turns on the stress hormone cortisol in the bloodstream. And cortisol can take several days to fully deplete out of the animal's system. So if an animal is presented with quite a big trigger, it causes the hot tap to turn on, their sink fills up a little bit. It might be, depending on the individual and the severity of the trigger, that it takes them several days for that sink to be able to fully drain again, which means that if their sink has got a little bit of water still in it and the taps turn on again, it's not going to take as much for the overflow response. So when our sink has got some water in it, it reduces our ability to cope with further stressors, and it reduces our tolerance for coping. So as first aid advice, our aim is to do two things: to turn the taps off as best we can, and increase pulling the plug out behaviours. So those are endorphin-based behaviours for dogs and cats. In terms of the turning the taps off, we've talked about the hot tap. So we've talked about trying to just avoid the triggers, the hot tap, and maybe doing a pain relief trial, for example, or dealing with the medical issues that might be underlying it. When it comes to the cold tap is good in small amounts. The cold tap stops the sink from overflowing and people getting burnt. But we just need to make sure that owners aren't massively encouraging lots of cold tap behaviour. So by that, I mean when owners come home from work, how are they greeting their dog that's maybe struggling to cope when they're home alone? Are they coming home and really exciting the dog and going, "Hello, I've missed you too," and really ramping the dog's arousal level up? Or are they staying nice and calm and still saying hi to their dog? I'm not a fan of ignoring social species when bonds need to be reunited, but just calmly saying hi to the dog and keeping arousal levels lower. Are they taking their dog to the park and relentlessly throwing a ball for half an hour, back and forth, back and forth, back and forth, and really ramping that dog's adrenaline levels up? Or are they throwing the ball a couple of times, putting the ball away, letting their dog go off and do some sniffing and maybe say hi to a couple of other dogs, and then they might get the ball out again a little bit later? So we're interspersing the tap being turned on and the plug being pulled out. And let's talk about plug draining activities in dogs and cats. So both species, or mammals in general, use repetitive oral behaviour to calm themselves down. So they might groom them, lick at themselves. I've put not grooming here because there is a difference in cats that are doing a full body groom prior to having a long nap and having a quick lick at their coat. The quick lick at themselves will often happen after something a little bit stressful, so something that's caused their sink to fill up, and they'll often do a very quick lick at their coat to bring themselves back down. Sometimes they'll do nibbling on themselves, and for some they might lick at humans or others, and they might lick at surfaces. Again, all of this comes with the caveat that they haven't got gastrointestinal issues, because all of these can be symptoms of a gastric issue, or it can be an issue of pain, indicative, of pain if they're repeatedly licking themselves on a body part. Both species need plenty of sleep and plenty of comfortable resting places. Cats will generally prefer to have resting places up off the floor or in a hidey hole. And dogs, I'm a big fan of having a variety of different resting places, because sometimes they're hot and they like to stretch out and sleep. Sometimes they'd like to curl up in a tight ball and sleep. Sometimes they'd like a really comfy resting place with high sides. Other times they might just want a flat, comfortable bed area. So the more variety owners can provide, the better. Animals, when they've had adrenaline through their body, they will also need to do what we call a shake-off. And this is where, like when a dog gets wet and they shake their coat to get the water off them, if an animal does that when they're not wet, it will generally be a sign that they have had adrenaline rush through their body and they need to shake that adrenaline and that tension out of their muscles. So it's a positive sign that they are recovering from something that's just happened. I call it a reset button. So I like to praise my animals whenever I notice them do it. But equally, I use it as a sign that something has just happened. And I like to think to myself, oh, what just happened then that caused them to need to shake off in the first place? You will see this all the time in the vet practice. So once you've finished your examination or your treatment and the animal is back with their owner on the lead, ready to leave, at some point they will shake off, I guarantee it. Now, some of them might not do that until they are out of the building and down the road, but for different individuals will recover quicker than others. We ideally want the shake off to be a really quick recovery, so within a few seconds of something difficult from happening. They'll also use stretching a little bit the same way, so they're stretching their muscles out and loosening themselves up a bit after something that's caused a bit of tension. They'll use yawning. Yawning can happen both when they're starting to feel a bit stressed and anxious, but they'll also use it to bring themselves back down. It's that oral behaviour again. Both dogs and cats navigate their world through scent. So scent work, sniffing, whether it's air scenting or ground sniffing, is really important for both species. So letting dogs sniff as much as they can on walks. Maybe we might do some search games for both dogs and cats around the home, so they have to search for some of their food portion, for example. We've got the supplements that can also help to just keep that sink drained. I'm a big advocate for both species of daily exercise and fresh air. Now, obviously with indoor cats, that might be slightly restricted, but I still think we need to get fresh air into the home through windows that aren't open enough for cats to get in, or through mesh on the windows or doors. And again, for both species, exercise increases dopamine and endorphins for all mammals again. And just making sure that all of our human interactions with our pets are positive. We've already talked about the implications of using punishment-based methods when there's a behaviour problem. Okay, so we're going to talk through 2 dog cases now. Then we're going to come on to cats and we'll talk about 2 cat cases. So first of all, this is Archie. He was referred to me for separation issues. He's a 2-year-old entire male Springer Spaniel, and through questioning the owner, some of the important information that I found was that he was rehomed from the breeder at 6 weeks of age. Now, I'm not sure what the legalities are over in Singapore, South Korea, Hong Kong, but over here that's illegal to rehome puppies at that age. 8 weeks is the minimum. And that is because at 6 weeks old, they should still be gaining a lot of really important social information from their siblings and hopefully also their mum. So Archie's expression of separation distress when he was left home alone was that he would destroy the carpet particularly around the front door. He would also vocalise a small amount. I've got some videos to show you in a moment. Because he'd destroyed the carpet around the front door, the owner had started putting a barrier to prevent him from getting to that carpet area in front of the front door, but he'd just started to rip up the carpet from behind the barrier nearest the front door. The owner was generally home with Archie, so they worked from home and he wasn't left home alone very often, which is beneficial when it comes to working on his separation, because we can do it in nice controlled sessions. Like we've said, the first stage is to try and avoid rehearsal of the behaviour. So we don't want them to keep repeatedly leaving him so that he's getting stressed and ripping up the carpet. However, the owner also reported that Archie wasn't able to settle. He couldn't lie down and he couldn't sleep when the owner was home, so he wasn't getting anywhere near enough sleep. He was just sleeping overnight, but during the day he would generally pace a lot, follow the owner from room to room, get up to mischief, get into everything, lots of attention-seeking behaviours, all of that kind of stuff. The owner loved Archie very much and would heavily encourage him to sit on their lap on the sofa, which is fine. Again, it doesn't mean that an animal's going to have separation issues, but in this case, it was relevant. So the owner was encouraging Archie to follow her everywhere and to have him on her lap. He didn't have any of his own places to rest, so there were no dog beds in the house. He just had the sofa where the owner was sitting and the bed at night where he slept on the owner's bed with her. When he was left home alone, he was restricted to the hallway, and part of this was because of the destruction and minimising the destruction to the rest of the house, which is fair enough. But that isolation or segregation was not normal for Archie. He normally had access to the whole house when the owner was home. He was also a very anxious boy in general, so the vet had very sensibly not recommended castration for this dog, and I'm going to come on to neutering at the end of this webinar very briefly. But when an individual is quite anxious, they need the testosterone, because testosterone is a confidence-giving hormone. So it was very sensible of the vet to keep this dog entire and not advise castration. He was also very fearful of noises such as fireworks. And again, there may be this link here between separation issues and noises. And that might be because he might have been left home alone one day and loud noises went off when he was home alone. So he now associates being left home alone with potentially some scary noises going on, which has made him anxious about being home alone. I'm just going to show you a video and then we'll discuss what advice we gave. So you can see the pen that they've put across the front door, or Archie's figured out the cameras there. And you can hopefully see the other side of that pen, the carpet's been ripped up. So they've left him with a couple of chews, which he started off with. So it's not instantly going to rip up the carpet. You hear the vocalizing there, the whining, looking at the front door. Now started scrabbling at the carpet. So he's stopping to listen. That's really common in dogs that are left home alone and get distressed. They like to, now you can hear he's really ripping up the carpet. And I just want you to notice any changes in his body language and the vocalizing from the beginning of before he started shredding the carpet through to once he really gets going with the shredding of the carpet. Okay, so when we've got an owner that comes in and says, my dog cannot cope with being left home alone, it's either vocalizing and the neighbours have complained, or it's destroying the house, or it's maybe toileting where it's otherwise fully toilet trained. Those are the three main common symptoms, but we can also get things such as a dog that's just repeatedly pacing, and an owner might not be aware of some of these symptoms unless they set up video footage, and it's something that I encourage all dog owners really to do, but particularly for puppy owners when they're building up leaving the puppy home alone. It's really useful to know what the dog does when they're left home alone and whether they are actually coping or not, because again, some owners don't have neighbours to complain about vocalizing, so unless a neighbour does complain, they don't necessarily know that their dog is howling, for example, the whole time they're home alone. So some dogs might pace and be unable to settle. Some might not be able to eat anything that's left for them. Some might excessively drool or salivate when they're home alone. In rare cases, some dogs will also self-harm through chewing at themselves quite badly through stress. So video footage is essential in any case of separation issues, because we need to see exactly what the dog's doing, how long it's able to cope on its own before any of the behaviours start, and if there's any patterns for behaviour. So, for example, it might be that an owner thinks their dog is not coping when they're left home alone. The dog might be fast asleep for the majority of that time, but when the postman comes to the door and knocks on the door, the dog goes berserk, which it does when the owner's home, and then it's unable to calm themselves back down, and that then leads to the challenging behaviour. The first aid advice for separation issues is that we need to try and find ways to avoid the dog being left home alone past the point of them being able to cope, whilst we build up that tolerance and understand why the dog isn't coping very well. So that takes the video footage to understand why the dog isn't coping. So we say it takes a village. Can we ask friends, neighbours, family? Can we use social media to reach out to people? You know, there are lots of people out there who are dog lovers, who aren't able to own a dog, but might really love the company of having a dog with them when they're working from home or home alone, for example, to stop the dog being left home alone. So the full treatment plan will depend on the diagnosis. Is it that the dog is frightened of being left home alone because maybe the home was burgled when the dog was home alone one time, and now they are frightened of being left home alone? Are they genuinely anxious about being left home alone, that something negative might happen? There might be fireworks that go off and they're not able to cope without the owners present. Is it that they are hyper attached to one owner in particular, so the dog can't cope even in the presence of other people? Those are much harder to treat. Those ones generally will need medication support, as well as a huge adjustment in the owner interactions with the dog, which is also very difficult because normally that hyper attachment is two directions. Is it that the dog is experiencing fear of missing out? So they are just annoyed or frustrated that the owner has left without them and they've been stuck home alone? Is it that the dog is bored and they're not getting enough mental or physical stimulation? Maybe they, the destruction that the owner is reporting is actually the dog just raiding the bins because they are opportunistic scavengers and they're bored, and shredding the tissue and the paper out of the bin is fun when you're left home alone. Is it that the vocalizing that's been reported, actually when the dog is sitting looking out of the window waiting for the owner to come home, and they are barking their heads off at everything that passes that window? It might be that when the owner's home, the dog doesn't spend as much time looking out of the window, or that the owner stops the dog from barking and tells them to get down. So when the owner's not there to tell the dog to stop barking, they bark, and they bark a bit more. So we need to determine exactly what is going on with that dog by video footage and by some questioning. We need to make sure that the dog's basic needs are fulfilled. We need to make sure that we are reducing any other triggers in the dog's life that might be causing stress, and we need to make sure that we are providing as many sink draining activities as possible so that they are better able to cope with being left home alone. For Archie in particular, I know that we needed to increase his ability to settle when the owner was present. There's no way we can expect this dog to settle and relax when the owner's not home if he can't even do it when the owner is home. So we provided him with his own resting places, and we actively encouraged and trained him to settle in those places and built that little bit of independence away from the owner. We introduced barriers to the home when the owner was home, so he didn't have free access to the whole house, and that then was taken away from him when the owner was left home alone. So we used the pens as gates or to just restrict off certain sections of the home so that he didn't have an expectation of being able to go wherever he wanted, whenever he wanted at home, which was then suddenly taken away from him when they left him home alone. The vet did prescribe some medication for him because he was such a generally anxious boy. But from that video footage, I also observed that the act of destruction for him was actually a calming behaviour. So he started off with the whining and the vocalising, a little bit anxious about the fact he'd been left home alone. But if you noticed, his body language changed whilst he was digging and ripping, and his tail started coming up and was even wagging at times. So that oral behaviour and that activity that he provided himself actually was his coping strategy. So we provided him with plenty of these kind of independent activities, again, when the owner was home, because what I didn't want to do is provide them only when he was being left alone, because otherwise providing him with those items can induce anxiety because he can associate them with being left home alone. So we needed to make them a plentiful supply, lots of items to chew at, cardboard boxes to shred, activity feeders to get his food out of, etc. And then when he was home alone, we gave him access to the lounge. We used live camera video footage so the owner could leave the home and watch from their phone, and make sure that they were returning whilst he was still relaxed. It might not be that he's able to sleep and properly switch off for a while, but through repeated absences where he's not getting to the point of feeling stressed, where he is able to settle and he is able to interact with any of the activities that have been left around the house for him, through repeated separations without him getting stressed, he did start to learn that actually absences from the owner are okay. And this is Barney. Barney was rescued from abroad. So he was already neutered when the owner got him. He was a few years old, we're not quite sure how old. He was rehomed to new dog owners and he was the only animal in the house. And Barney was barking and lunging towards any other dog he saw on walks, even if they were right on the horizon and the owner could barely see them, he would go berserk. He pulled on the lead when they first got him, so they were walking him in what we call a no-pull harness, which is a harness that tightens up around the kind of armpits and shoulders when the dog tries to pull. And they felt they had more control, but Barney hated having it put on, so it was an ordeal. He tried to run away at home and they had to corner him and catch him and manipulate his legs to get it on him. And they reported that he never sniffed on walks. He would spend his whole walk like a giraffe with his neck and head in the air and scanning the horizon all the time, and then would react on sight of other dogs. So when we have an owner reporting that their dog is very reactive or aggressive, sometimes they'll call it, to other dogs, we need to determine what is the first aid advice we need to implement. Do we need to say, your dog must be kept on a lead or a long lead at all times? Does it have 100% recall even around other dogs? If the answer is no, then they will need to be kept on a lead or a long lead, because they don't have control over their dog that is going to be potentially aggressive to other dogs. Do we need to advise that they muzzle train? So what would happen if an off-lead dog ran up to that dog on a lead? Is there going to be a potential bite incident, in which case the dog must be kept on a lead, but also muzzle trained whenever it's out of the house? Do we need to advise the owner to just increase the space and the distance whenever they see another dog, to turn and walk the other way for now? Just avoid those situations where the dog rehearses that seeing another dog equals barking and lunging. We need to ask the owners what walking equipment they're using, because if they're using equipment that the dog finds uncomfortable or that creates discomfort or even pain when they try and pull, what we're doing is filling that sink up. The hot tap is getting turned on before we've even seen another dog. And how does the dog respond when the owner is putting the equipment on? Because again, in Barney's case, where he's already showing an anxious response or a fear response even to the harness, his sink is already full before they've even stepped out of the front door. So do we need to look at either the type of equipment or the way in which they're putting it on? Can we get a harness that goes on over the dog's head, and we can again use a food treat so the dog is choosing to put their head through the harness and the owner then clips it up, rather than having to manipulate legs into the harness? A lot of owners, when they have a reactive dog, particularly bigger dogs, they tend to go shorter with the lead or hold it very short and very tight in an attempt to feel more in control. Unfortunately, from the dog's perspective, that's going to increase a fear response, that they know they have no other choice but to react because they can't choose to move away. And it's going to increase the perception of frustration that they can't move away. And generally, the longer the lead, the less reactivity the owner will observe. But we do need to make sure that they have handling advice so that everyone is kept safe when they've got a little bit more freedom on the dog. So restraint and restriction will increase the reactivity response because the dog's other response would be to try and avoid or move away, but it also increases frustration because they are thwarted from being able to either run towards or move away from something. In Barney's situation, we needed to work on relaxation outside when there were no dogs present. So can he walk on a loose lead on comfortable equipment? Can he sniff and engage with the environment and get his head down and lowered rather than staying hypervigilant? This is less relevant for Barney, but for other reactive dogs, a major question we need to ask is, does the dog feel safe? Because we cannot start training a dog in any situation if they don't feel safe in that situation. They are quite literally in fight or flight mode. So we need to put put measures in place so that walks literally are kept really short, nice and positive, lots of sniffing opportunities, and we come home again and we build up the dog's confidence outside of the house to start with. What's the motivation for the reactivity? Is it that they're frightened of other dogs and they're trying to scare dogs away from them? Or is it that they're frustrated that the lead is thwarting them from being able to run up and say hello to other dogs? So in Barney's situation, he was actually a very sociable dog. He'd come from a shelter in Romania that was group housing. So we lived with lots of other dogs, and the owners had seen video footage of him in this shelter with lots of other dogs, and he was very sociable and interacting completely appropriately. And he had been rehomed into a home with no other dogs, and the only dogs he saw were at distance and on a lead, and he wasn't used to a lead either in the first instance. So all of a sudden, he's gone from having free access to have lots of doggy friends to suddenly having restricted access with a feeling of a lead and not being able to get up close to any other dogs. Most responsible Romanian rehoming organisations will only rehome those dogs into a home where there is already another dog, because that social drive is so important in those dogs, and it can create these sort of issues when they are not rehomed with another dog. So for Barney's situation, we needed to fulfill his social needs, but we needed to do that carefully. It's not appropriate for him to be rushing up to other dogs, that are miles away across the other side of the field. We needed to make sure that the owners had control, that they had a good recall, they could call him back, and that he was able to approach and interact with other dogs. We used a fence to start with so that he was off the lead. He wasn't restrained by a lead. He still had the restriction of a fence between him and the other dog, but he was able to sniff them and greet them and have a conversation with another dog through the fence. We could practice calling him away from the other dog. We could practice him approaching on a lead, much calmer towards another dog through the fence. And we associated the presence of a dog whenever he saw another dog. Good stuff came from the owner. So he started to learn that when he was on a lead on a walk, when he saw another dog, good stuff would come from the owner. And he would, instead of pulling, lunging and barking towards the dog, he would check in with his owner and walk a lot calmer, and learn that sometimes he could go and say hello to another dog as well. Now, to start with, group class training is not appropriate for reactive dogs until we have worked out what the motivation is. If it's a fearful dog, you do not want to put them into a group situation because it's going to be too much for them. We need to make sure it's a nice dilute introduction to other dogs at a distance they can cope with, where they feel safe, where they can be relaxed, and we can associate other dogs with good stuff. In Barney's situation, eventually he did progress to a group training situation where he could, once we knew he could cope with meeting dogs politely and seeing dogs at a distance on walks, his owners then took him to teach him to focus on them in the distraction of a room full of other dogs. Very quickly, I'm just aware of the time, we'll move on to cats. So our domestic cats have the common ancestor of the African wild cat, and they're quite unique, and we're quite privileged, I suppose, because the African wildcat still exists today. So it's really useful for us to be able to observe and study the African wildcat and see the traits that our domestic cats still carry from these African wildcats. So we know that they are a solitary species, and that doesn't mean to say our domestic cats are, but it's important to just register that African wildcats are a solitary species. They are hunters, which means they are predators, but they are definitely, and this goes as well for our domestic cats, who are also solitary hunters, so they won't hunt as groups. They are extremely territorial, and they use chemical communication, scent communication to mark out territory areas so that they are less likely to have visual encounters with each other. They have multiple well-distributed resources. So they have lots of areas that they go and hunt in and eat in. They have lots of areas that they go and drink from. They have lots of toileting, lots of different toileting areas, and none of those areas are close to each other. So they will not take their kill near to a water source, because there is a risk of that water source becoming tainted by the dead mouse that they've killed, for example. And again, that's very relevant to our domestic cats. They are designed to avoid conflict as much as possible. So as I've said, they use this scent and chemical communication through pheromones deposited from their cheeks and their chin, through urine marking, through defecation areas as well. Oh, and through scratching. That will leave both a visual message, but also leaves a pheromone from glands between the pads on their feet that other cats will also be able to pick up on. As well as them being predators, they are also a prey species, and that's again really important when it comes to how our domestic cats might find living in the home with another dog, for example. Okay. So let's briefly talk about multi-cat households. So we've talked about the African wildcat being solitary. Now, we know that the domestic cat is more sociable. Sociability has been bred into them. So we know that some cats really enjoy the company of other cats, but that's not true for all cats. And importantly, I think owners just need to be aware of when their cats in a multi-cat household are part of the same social group and when they are not. And if they're not part of the same social group, they are tolerating each other at best. And if we don't provide enough resources and alter the environment for two or more separate social groups, that can be where conflict becomes part of the issue. So we know that cats are part of the same social group, or they are bonded, if they wash each other, so they mutually clean each other. They sleep in physical contact. So this photo here, they are not in physical contact. By physical contact, I mean like croissants wrapped up, touching each other. There's a scent transfer element to what is going on there. And if they greet each other with nose sniffs or facial rubs, or they might go down each body might run down the side of each other, and their tails might link up as they pass each other. Owners will often miss some of these subtle signs. So if their cats don't groom each other, don't sleep together in physical contact, and don't greet each other in an affiliative manner, the owners might miss those signs, but they also might miss subtle conflict signs. So cats that stare at each other, or one cat that might stare at another cat in the household, might be from a distance, but direct eye contact in both cats and dogs is threatening and controlling. So the staring cat is effectively saying, I've got my eye on you, and I will have no hesitation in escalating if I need to. They might also just use body positioning to block another cat's access to something. So a cat might just sit at the top of the stairs. The owner doesn't think anything of it, but actually that positioning is very meaningful, and they are controlling another cat's access to either coming up the stairs or down the stairs. You might have a cat that does a lot of avoiding of walking past other cats in the house, or hiding a bit under the bed from other cats in the house. The owner just thinks that that's its preferred resting place, but it could be an avoidance strategy. Because no cat is an obligate social creature, and by that I mean they don't require social contact with another cat for their emotional homeostasis. It means that even if they are bonded, it's quite easy for that bond to be ruined. So once conflict has developed between two cats, it's very difficult to go back. So we need to be very careful about initial introductions when an owner is bringing a new kitten into a home or a rescue cat into a home of an existing cat, and reintroductions. So after a period that one cat has been in the vet practice in particular, that cat is going to smell foreign, it's going to smell of the vet practice, and bringing that cat back into the household can be a really common source of hostility, and then that ruins the bonded pair. So make sure we have got information sheets for owners. If they are thinking of bringing another cat into the household, that introduction might need to be done very slowly over days or weeks, with having separate areas to start with. So one cat might have one area of the house with the doors shut, the other might have the other area. We might swap them over so they get to smell the area the other cat's been in. We might use scent cloths to transfer the scent of the other cat. We might, when it comes to visual introductions, we might need to put a mesh screen on a doorway, for example. And reintroductions after coming home from the vets, the cat that's been at the vets needs to be given a chance to recover, come home, recover from their ordeal, get the familiar home scent impregnated on their coat before then reintroducing to the existing cat or cats in the home. All cats in, whether they're a solo cat or multi-cat household, they need to have plentiful resources. So we say that for every resource, that is the litter trays, the food locations, and the drinking locations in particular, there should be one of each plus an extra one of each for every cat in the household. So there should be 2 of everything if it's a solo cat in the household. There should be 3 of everything if there's 2 cats in the household. And these should all be in separate areas. So it's no good having 2 or 3 litter trays side by side in one area, because the cat would just see that as one massive big litter tray, as opposed to 3 separate trays where a cat can urinate in one, defecate in one, and if one's taken up by the other cat in the household, they can choose to go to another spare empty tray. Just moving on to our cat case studies. So this is Altair. He's a beautiful 4-year-old ragdoll neutered male cat. He was referred to me for urinating and defecating on the spare room bed. This was less likely to happen if the duvet was removed from the bed and it was just the mattress, but he would still occasionally go on the mattress. He had 2 litter trays. He was the only cat in the household. There was a dog that lived downstairs. He had access to upstairs and he didn't like to come downstairs because he was quite scared of the dog. But upstairs he had 2 separate litter trays that he did use to toilet in both urine and feces. So what do we do when an owner is reporting that their cat is urinating or defecating not in the tray? Well, first of all, we need to determine whether, if it's urine, whether it's a spraying, marking issue, or whether they're depositing urine. One easy way of seeing that is if it's on vertical surfaces, surfaces that heat up, so in particular plug sockets. Cats will often urine mark in those areas on electrical items because it heats the urine up and increases the scent around the home of the cats. Very clear territorial marking, sorry, not marketing. Or is it that they are depositing urine normally on the floor? They might show some scratching up and covering up behaviours before and afterwards. And what are the locations of these urine sprayings or depositings? If a cat is feeling vulnerable about potential territory invasion from neighbourhood cats outside of the house, you might find that the marking and spraying locations are around external windows or doors, or in a room directly opposite an external window or door, so where they feel that the other cat can be seen or seen in. And if it's through perception of an internal threat from a multi-cat household, it's more likely to be around internal doorways, for example, or areas of conflict where cats might block each other. So the locations are really important information to us. We would question quite a lot about the litter tray provisions the owner has to determine if it's a depositing issue. Is it that the cat is just really, the litter trays are not sufficient for the cat? And I got this photograph of one of my cats going to the toilet outside once, and I noticed she dug a huge crater to urinate in before she then covered it up. Cats will generally prefer the gravel textured litter, several inches deep, so that they can dig a big hole and cover it up afterwards. Ideally clumping, so that owners can scoop urine and feces several times a day as soon as they notice that it's been used. And then cats also like, they're clean species. They like to toilet in a clean area. So it needs to be scooped multiple times a day. And the whole litter needs removing every 7 to 14 days, and the tray washed with just some washing up liquid and warm water. So we want to avoid using anything that's got a lot of scent to it. That will put cats off from using that area to toilet in. Through questioning the owner, we also need to find out when this started and what else was happening in their lives or the cat's life at around the time that this started. So for Altair, it wasn't long after they got the dog, but more importantly, and I think the dog ended up being a trigger stacker, so the sink was half full for him. He was worried all of a sudden about going downstairs. He was no longer getting as much social time with his owners. The dog was blocked off from going upstairs, by the way, so he did feel safe upstairs, but he still had this conflict where he quite wanted to come. He would sit on the stairs and sort of look like he wanted to come down and join where the owners were, but was worried about the dog. But most importantly for him, it started at a weekend where the owner had friends round, staying in the spare room, who had cats themselves, and they put their coats and their bags on the bed that smelt very strongly of their cats. He then got access to the spare room, toileted on their beds, on their coats and bags on the spare bed to start with, and from then on started to carry on using the spare bed to deposit urine. So for Altair, I think it was a mixture. I think it started off as a marking behaviour that was also triggered by stress from his kind of living situation. But then I think it transferred to a substrate preference. So the bed, the duvet in particular, was nice and thick and soft. And I think he was clearly telling us that actually once he'd urinated there, he realised it was more preferable substrate to the one that was currently in his litter trays. So we did a variety. We shut off access to the spare room to start with so that he couldn't keep rehearsing toileting there. We then did some litter tray preference tests. So we tested, does he prefer a covered tray or an uncovered tray? And we did this by having the two trays, identical substrate in them, right next to each other in the same location, but one was covered and one was open. And we discovered he never used the closed one, he always used the open one. We then provided two different litters in each tray so that we could determine which. So then we had two open trays, next to each other with different litters in, so we could determine which his preference of a substrate was. And we discovered through doing that the type of tray and the litter, the substrate that they were using was not his preferred type. We used pheromones in the spare room as well to teach him that the spare room was filled with the feel-good pheromones, so the facial pheromones of the cat, so that he didn't feel the need to mark his scent in there. And so he was a bit of an anomaly in that his marking behaviour wasn't spraying up vertical surfaces, but through the questioning of him marking these cat-scented impregnated items, it was clearly a marking behaviour to start with. And moving on to Poppy. Poppy was referred to me for showing quite extreme aggression to her owners, bad enough that one of them had been hospitalised. She was the only cat in the household, no other animals in the house. It was a sudden onset. She'd always been a lovely disposition and no problems with her at all. And the owners couldn't work out what the trigger was. She just apparently launched at them from across the room, yowling, and attacked them. And they would respond quite naturally by shouting at her because it hurt and shocked them, but they would then roughly handle her, scruff her and throw her out of the room to get her away from them. They also, the vet medical history reported that she had been in to see them in the last few weeks because she'd had a recent bout of feline idiopathic cystitis. So again, when it comes to aggression, we need to find out a little bit more information. So what exactly was going on around the time that these events were happening? Can we identify what the triggers are? Whilst a natural human response to something incredibly frightening, painful and stressful is normal, we just need to also outline to owners that in terms of teaching the cat not to do something, that punishment isn't going to help. So in case they are doing it thinking that they're doing the right thing by telling the cat off and isolating it, we just need to make clear that it's unlikely to be helping. We need to make sure that the whole house is as feline friendly as possible. So we are reducing any trigger stacking. We've got all the resources that the cat needs in the home so that they don't feel that they have to go outside to get hunting opportunities or to go to the toilet, for example. So even if it's not an indoor cat, we need to make sure the cat has litter trays inside and that the owners are playing with lots of interactive toys, like in this photo here. This is my cat, so that the cat feels no need to go outside unless they really want to. In this instance, I was questioning, because there was no other animals in the home, my first line of questioning was, what about neighbourhood cats? And they reported that a neighbour had got a new young male kitten that had not long been let outside, and he would regularly come into their back garden, and Poppy wasn't spending as much time out in the garden anymore. She would sit at the window and watch him, and would her tail would be flicking around as she watched him. And through questioning, it actually transpired that the aggression towards the owners was as a direct response to her sitting and watching and seeing this male kitten come into her garden. So we would label this as a redirected aggression, or a massive frustration response, where her aggression wants to be directed towards the cat, but she is redirecting that frustration because she either can't get to the cat or because she's too scared to go outside and see the cat off. So she's redirecting it onto the owners. So we needed to make sure that we were preventing this kitten from ever coming inside the house. That is an absolute no-no. It had never come inside the house at this point, but we needed to make sure it was never going to get the opportunity to. So we needed to make sure she had a microchip cat flap so that that cat could never access inside her home. She was already finding it stressful enough that he was in her peripheral territory. We never want cats to be able to invade core territories. We needed to increase her play and hunting opportunities in the home. And also just make sure that she wasn't bored because she wasn't spending as long outside anymore. And we used her feeding regime as well to alter that time-energy balance. So she was working for all of her food portions. She wasn't getting a bowl of food put down twice a day anymore. She had 5 small meals a day that were all given via activity feeders or distributed in little piles around the house for her to search for. And we placed frosting on the bottom half of the relevant windows so that she no longer felt the pressure of sitting and watching him outside, and she felt safer in her core territory, knowing that he couldn't be looking inside into her territory. We did talk about making the garden more cat-proof so that it was harder for him to get into the garden. It's quite expensive to do that over here, and the likelihood is he could still, if he was really motivated to, he could still get into the garden, but it would prevent him from being able to get back out. So we definitely didn't want that situation. Very quickly, I'm just wrapping up. The industry, in terms of, a lot of people ask, what is the difference between a behaviourist and a trainer? So the difference I would describe is that a behaviourist looks at unwanted behaviours or undesirable behaviours, and we look at the animal's emotional state. So what is underlying the animal showing that behaviour? Is it a fear response? Is it that they're anxious? Is it that they're frustrated? Or is it a whole mixture of all of them, which it very commonly is? Whereas training is about teaching an animal to respond to cues using consequences. And we can do that in two ways. We can use pleasant consequences, so giving something that the animal likes or removing something unpleasant so that they're more likely to repeat the behaviour. Or we can deliver something unpleasant or remove something that they like so that they're less likely to repeat the behaviour. So there is a big overlap, because the training methods that we use will lead to a positive or a negative emotional state, or they might induce frustration, for example, or fear or anxiety if we're using pain in the name of training. It also works the other way around, because a good trainer will also be aware of a dog's emotional state, because when they are stressed or anxious, they're not going to be able to learn new cues as well. And what can also happen is the emotional state becomes attached to the cue. So if we're using something that's causing fear, anxiety, or frustration in training methods, then that cue that we give, they'll associate with that emotion. And very quickly, just because I think it's important, about neutering, I've already touched on dogs and castration. So when it comes to an owner reporting their male dog doing some behaviour, we need to determine whether castration might benefit or hinder the problem. If it's a dog that is fearful or anxious, then castration may make the problem worse, because you're taking away the only bit of confidence in the testosterone that dog does have. If they are a frustrated dog and life is very frustrating to them, then castration may well help. It's important to realise that adolescent male dogs go through testosterone surges throughout the kind of adolescent period, which is up to about 2 years of age. So it might be that the owner just needs to work through those testosterone bursts, increase their management and first aid to stop the dog rehearsing behaviours, and it will actually settle itself out in the end. And then with bitches, generally, as long as the dog is kind of physically mature, behaviourally, there's no problem with spaying bitches as long as they don't find the procedure at the vet's massively stressful. But we do need to be aware of the timing of when we spay them, so that we're not at risk of causing a persistent phantom pregnancy. So any bitch that comes in to be spayed, we need to make sure that they are absolutely not showing any signs of a false pregnancy. So we need to express their teats, make sure we can't squeeze anything, even clear liquid, out of them. We need to question the owner with behavioural signs at home that they're not showing any nesting behaviour, or that there's been no change in anxious or aggressive behaviour during that period of the dog's cycle. And we do not want to spay them if the answer to any of those is indicative of a false pregnancy. We either need to wait as long as you're prepared to, up to towards the next, when the next season's likely due, or we need to treat them for a phantom pregnancy before spaying. Thank you very much. I'm sorry I've gone over. I like chatting too much about behaviour once I get started. I mentioned muzzle training a few times through that. If you would like a muzzle training handout, I have a Word document that I'm more than happy to send you. My email address is here, that you can put onto your own branding on it and distribute it to clients, or have it in reception to give out to clients if it's helpful. So feel free to email me, feel free to give me a follow on my socials, and I hope you found that useful.
There we go. Just waiting for my camera's come back on. Yeah. Oh, thank you so much, Rosie. That was really brilliant. Yeah, just on a quick note, that was going to be my first question actually about muzzle training. I was like, oh, I'd be interested to know more about muzzle training. So that's really cool that you have that guide. But yeah, first and foremost, thank you so much for doing the session. There's always, every time I sort of listen to anything like this, always pick up so many super interesting things that I sort of think, I often look at my own animals and think, maybe there's things like, I noticed that our cat just stares at us like constantly. So I'm like, oh, he knows there's something going on there. So I've definitely got a couple of things to try with that. But also think it's so great for those little nuggets and bits of information in terms of how we should be thinking about cases that come into practice. I mean, I found that the sync analogy that you're sort of talking about, I used to use that in practice all the time, because it's something that owners just understand and get, but you can also explain when you're in a consult and you haven't got much time. It's really easy to explain to people. But I think as a community and as an industry in the vet world, I think there's definitely, we're starting to do more things behaviorally, especially in terms of what we can do in practice as well. But I think there's way more that we can be either helping with or, referring owners on to behaviorists as well. There's so many different aspects. I know we obviously focus at Protexin a lot on the nutraceutical side and Serenicare, but just in terms of disseminating information to owners, I think there's way more that vets can be doing. So yeah, I think that was really interesting. If anyone has any questions, we can put them in the chat. We'll wait a couple of minutes for that if anyone has any, but I'll be following up after this session anyway. So if anyone has any questions, please contact either our distribution partners, so that's Maxipro, Tips and Samdom. But if not, then I'll speak to you guys soon anyway. And if you have any questions, you can always ping them through on there. But yeah, thanks again. And I think yeah, I hope I'm not jumping the gun, but I think we're keen for another session if people have other topics that they want to discuss. So have a think about, for you, all of you who have attended, think about sort of what you might want to know more about next if we had another session with Rosie, because I think that could be really useful, sort of diving a bit deeper into some of these really specific things. I know especially like the multi-cat household things, that would always come up in practice. The classic that you said, oh, we've got an old cat. We're thinking about getting a young kitten because, he's getting old and lonely. And I'm always thinking, is that a good idea? And I knew a few of these ideas, but I could never really convey that to owners very quickly or well within a conversation. I was like, I know there's, maybe that's not a good idea, but how do I actually communicate this to my owners? So I think, yeah, some follow-up sessions I think could be really useful. But certainly if everyone, yeah, I'll be in touch and we can put some ideas forward and then we can go from there.
Perfect. Yeah. I always say I could do a whole webinar on each individual topic I've brushed upon today. So yeah, if anyone does want to expand anything, just let Rupert know and we can think about that.
Brilliant. Cool. So I can't see any questions now. So I think obviously, yeah, we've overrun a little bit. So I'll let everyone go and have their dinner and go to bed. I appreciate it's very late for you guys. We're okay in the UK, but for everyone else, yeah, it must be time to go and get some sleep before tomorrow. So yeah, thank you again, everyone, for your time, and thanks so much, Rosie, for putting this session together. It's been really good fun. Me. No worries, and we'll leave it there. So have a good night, everyone. Have a good evening.
Bye bye.
Bye bye.